Good afternoon. My name is Kieron Lim. I am a senior consultant in gastroenterology and hepatology at the Mount Elizabeth Hospital in Singapore. So the most striking trend in liver disease over the last 5 to 10 years is number one, the decline in hepatitis C. This is largely attributed by the very potent and effective medications that have come online around 2010, and this has drastically reduced the incidence of hepatitis C around the world. In tandem, as hepatitis C falls, the incidence of fatty liver disease is steadily climbing, and this is a trend that has been seen globally in Western countries as well as in Asia. So liver cirrhosis is the end stage of liver disease, and this is characterized by significant scar tissue forming in the liver. There are many reasons and causes for this to happen. The three common causes include viral hepatitis, especially hepatitis B and C. As mentioned earlier, hepatitis C is largely not a problem anymore due to the very efficacious and effective medications that are available on the market. The other problem due to causing liver cirrhosis includes alcohol, but the fastest rising single cause is fatty liver disease. So the complications of liver cirrhosis include jaundice, which is a yellowish discoloration of the eyes and the skin, ascites, which is the accumulation of fluid in the abdominal cavity. Varices are blood vessels that can enlarge and form in the esophagus, in the food pipe, as well as in the stomach. And these can potentially rupture and bleed and cause internal hemorrhage. Another complication commonly encountered is called hepatic encephalopathy. This is a very big medical term for liver patients being confused. And this is a spectrum from mild concentration, poor concentration, mild sleep disturbance, all the way to very deep coma. And this occurs because the liver is not able to excrete the toxins from the body efficiently, and it results in a buildup of ammonia which cross into the brain. Another complication that is very often feared is the development of primary liver cancer or hepatocellular carcinoma. When these complications arise, the patient should be urgently referred for consideration and evaluation for a liver transplant. So the greatest advancement, I think, is the discovery of very potent antiviral medications, and I alluded to this earlier, so much so that hepatitis C is really on a decrease, and in some countries, certainly we are, like in Australia, they are looking to eradicate hepatitis C totally from the country. There's extensive research undergoing now to try and combat fatty liver disease. There are many clinical trials undergoing at present, and hopefully in the near future, we will have a medication available to us as effective as the hepatitis C medications, which can reverse and cure patients with fatty liver disease. This will be a multidisciplinary program comprising and helmed by very experienced specialists to look after, in a very holistic way, the transplant patient as well as the donor. The core group of specialists includes the liver surgeon, the hepatologist, an intensive care specialist, infectious diseases specialist, as well as a multitude of specialist nurses and allied health professionals. So in Singapore, I think one of the key challenges that we face is the low donation rates in our cadaveric donation. This is something which I think many Asian countries are experiencing, and this is the reason, the main motivation why living donor liver transplant has been developed and been very successfully carried out in various parts of the world, from Korea, Japan, Hong Kong, Taiwan, as well as in India. And Singapore is no different. We also offer living donor liver transplant for our patients. What's unique in Singapore is that on a case-by-case basis, the potential donor can be also an emotionally related donor. So typically donors are next of kin and family members. However, when certain conditions are not met and potential family members are not suitable for donating their livers, individuals with a very strong emotional relationship, for example, old childhood friends and close colleagues, can be considered for liver donation for the liver transplant recipient. So over the last 50 years, I think liver transplantation has advanced in leaps and bounds. When transplantation was first offered as a treatment option, the 1-year survival rate was close to 30%, which means that 70% of patients were not alive at 1 year after the transplant. Fast forward to current day, the 1-year survival is approaching 85 to 90%. So it has been with better surgical techniques, better intensive care, better medications, transplant patients are living better and they're living longer. So my advice to the doctors who are seeing patients with liver disease is to urge you to have a low threshold to refer such patients with cirrhosis, and especially decompensated cirrhosis with complications, to a liver transplant center for early evaluation for liver transplant. For patients, I would also urge you to have regular follow-up with your regular physician and to be sensitive to new symptoms that may arise and to seek medical treatment early, because early detection is key, and to initiate treatment to prevent the progression of liver disease so that we can prevent the development of cirrhosis and its complications.